And we're ready, Sandy.
Hello, everyone, and welcome to the Cannabis Crossroads webinar series, generously supported by the Conference Fund at Memorial University. My name is Sandy Brennan, your host for today. Cannabis Crossroads is brought to you by the Cannabis Health Evaluation and Research Partnership Team, or CHIRP. CHIRP is a multidisciplinary research group based at Memorial University, funded by the Canadian Institutes for Health Research and the Canadian Centre for Substance Use and Addiction. The team has investigators in pharmacy, medicine, education and psychology, and a wide range of external stakeholders on the advisory panel. We will begin today's event with a land acknowledgement. We respectfully acknowledge the territory in which we gather as the ancestral homelands of the Beothuk and the island of Newfoundland as the ancestral homelands of the Mi'kmaq and Beothuk. We would also like to recognize the Inuit of Nunatsiavut and Nunatuavut and the Innu of Nitassinan and their ancestors as the original people of Labrador. We strive for respectful relationships with all the peoples of this province as we search for collective healing and true reconciliation and honor this beautiful land together. Please welcome our facilitator for today, Dr. Dina Guide, who is a postdoctoral fellow with the CHIRP team with a focus on public engagement. Over to you, Dr. Guide.
You're on mute there.
Sorry, so thank you everyone today for joining us for our discussion about cannabis use and driving. The CHIRP team has been examining the cannabis policy for the past couple of years, and when we started, we looked to the public and to the community stakeholders to identify priorities for our evaluation. While this exercise supported shaping the direction of our research, we also realized that there is a big need for public education. And there is a still lack of understanding and misinformation circulating about cannabis. So this Cannabis Crossroads webinar series meant to help address some of these needs. So today our panel of experts will be discussing the evidence of cannabis driving impairments, how the law enforcement handles it, and the perception of risk among drivers. So before we start, just housekeeping issue. So for those new to WebEx, there is a layout pointing toward the top right-hand side of your screen that gives you the options on how to view today's presentation. And Q&A will follow the presentation. So in regards to questions, our panelists will address questions submitted through the Q&A box, and we will not be offering the option to unmute yourself to ask the questions. So you may ask your question at any time, but they will be addressed toward the end. My colleague Sandy will be monitoring the Q&A, so please try to keep your questions short, and I encourage you to post your question as soon as possible and don't leave them to the last moment. One note about the content, a reminder that while we are discussing general concepts about cannabis use and driving, our panelists are unable to provide medical or legal advice for specific individuals. So please keep this in mind when you're posting your questions. This session is being recorded and will be available to view online at later date. So now it's my great pleasure to introduce our guests today. So we will begin with science perspective with Dr. John Weber, who is currently a professor in the School of Pharmacy at the Memorial University. He has recently initiated research to evaluate the potential anti-inflammatory effect of various cannabinoids found in cannabis plants. Then we will address the law perspective for cannabis use and driving with Sgt Karen Didham, who has a police officer with the Royal Newfoundland Constabulary for 27 years, and she has conducted hundreds of impaired driving investigations with alcohol and impairing drugs or a combination of both. And with Sgt Stephen Connahan, who has recently retired in his 30th years of service with RCMP. During his service, he has recognized by the courts as an expert in multiple fields, including cannabis. And the majority of his service was spent in drug enforcement. And then we will share team's research results with Dr. Jennifer Donnan, who is an assistant professor in School of Pharmacy at Memorial University. She is currently a principal investigator for the Newfoundland and Labrador Provincial Cannabis Policy Evaluation, and she's examining consumer preferences for cannabis products at the national level. And with Dalainey Drakes, who is an aspiring clinical psychologist. She recently completed her master in experimental psychology from Memorial University in 2021, and Lainey supported the engagement of youth and young adults while sharing her expertise utilizing the biopsychosocial framework for mental health. So thank you all for taking time to speak to our audience today. So Dr. Jean, you can start your presentation now.
Okay. Okay, you see it there?
Yes.
Okay. Okay, I'm just going to give a brief introduction to cannabis itself and some of the effects we know about it, and how it may affect driving. A lot that we don't know about cannabis. So I think most of you in the well, say that the virtual room here, maybe some of you don't know, but what is cannabis? Cannabis is a plant. A couple major species are Cannabis sativa and Cannabis indica. There's also one called Cannabis ruderalis. In general, Cannabis sativa will produce feelings of euphoria, very good, good feelings, can stimulate or energize individuals, whereas Cannabis indica is more of causing sedation and muscle relaxation and decreasing body pain. That being said, I'd like to say that the response to cannabis and the substances within the plant are highly variable, and there's no two people that really react completely the same to it. Most of the cannabis you find on the market today are hybrids of these major species. And in addition to some of the cannabinoids I'm going to talk about, there are a lot of chemical compounds called terpenes, and those contribute to the aromas, the scents of the and flavors of the plants, for example. So cannabinoids, those are the main active, or at least believed to be the active chemical compounds that are found in cannabis plants. And they really, the amount that are found in various types of plants or any sort of cannabis preparations will determine often the types of effects you may get from it. And I've shown, there's a lot of them here that are shown on the right side. So cannabidiol, CBD, and tetrahydrocannabinol, or THC, are the two major ones found primarily in the flowers, the buds of the plants. And those, of course, are the two major compounds that have to be on all Health Canada, or any products that are determined by Health Canada, that you have to show those on products, because they are typically the most abundant. And a lot of research show there's at least 120. I've seen other papers that say 140, maybe 160 different types of cannabinoids that are found in plants. So this slide shows a bit about some of the potential benefits, and I say this a bit with a grain of salt because there's a lot more research that has to be done. But I'll start on the right side there, those compounds that are psychoactive. So tetrahydrocannabinol, or THC, is believed to be the major compound that causes the psychoactive effects. And also there's some evidence that it's an antimicrobial and anti-inflammatory, etc. A few others listed there, THCV, tetrahydrocannabivarin, and cannabinol, are believed to be psychoactive as well, maybe not as strong as THC. And then on the left side, that's non-psychoactive substances. So the first one listed there is cannabidiol. So CBD, like I said, that's an important one because it's very abundant. And there's a lot of evidence that it can treat certain types of epilepsies for sure. That's been found. It also may be an anti-inflammatory agent, muscle relaxant. And the first thing listed there actually is that it relieves anxiety. So I don't actually think it's a non-psychoactive compound, because anxiety is a manifestation. It's a behavior. It's a manifestation of the brain. So I do believe that CBD is psychoactive in that way. And a few other non-psychoactive, or at least classified as non-psychoactive substances, are CBG cannabigerol and CBC cannabichromene, and they're believed to be muscle relaxants and anti-inflammatories. So the thing is, in cannabis, if you take the entire cannabis plant, if you were to smoke it, for example, it's not an effect of just one cannabinoid. It's not just THC. It's not just CBD. You do find different blends, different concentrations of those substances in the current, what we have marketed, for example. but it's likely a combination of all of these cannabinoids as well as the terpenes that create what's called an entourage effect. That's believed to be the idea that you need more than just one compound to really get the full effect of cannabis. So it could be a combination of a variety of cannabinoids, but terpenes as well. So here are some general effects of cannabis, and this is, I'm showing the effects of THC primarily. Again, that's the major psychoactive compound. And this is if you were to smoke cannabis. And smoking cannabis is still the most common way of ingesting cannabis, be it in a legal sense, or for example, if you get it on the black market. So I've shown some positive, neutral, and negative effects here. And these are somewhat subjective, but on the left side there, positive, I think, an increased better mood and relaxation, most people would consider those positive effects. A lot of individuals think it gives them more creative thinking, heightens their senses. This type of heightened senses is something that somebody may say that, oh, they feel like they're a better driver, which we'll talk about that a bit more as we go on. And also just a pleasant body feeling and relieving pain and reduced nausea. Those would normally be positive effects. Increased appetite could be considered neutral. That could be beneficial, for example, as well. But things like slowness and tiredness, that doesn't affect, that a lot of people wouldn't consider those negative per se. But for example, those are the types of effects that could be bad for something like operating a motor vehicle, as well as difficulty keeping a train of thought or concentrating. That could come into play with someone operating a motor vehicle. And then on the right side there, what most people would consider negative effects, things like nausea, a racing heart, respiratory problems. Respiratory problems are typically with more longer term use. But in higher doses or people that aren't experienced users, you may get anxiety, agitation, headaches, paranoia. Those would be considered, of course, quite negative. And another thing that's shown at the top here is how quickly cannabis affects you. If you are to smoke it, you'll typically get an effect within, say, 5 to 10 minutes. And all of these effects may last up to 2, maybe to 4 hours. And that's what's shown in the graph here. And every now and then there's somebody that you could measure effects up to 6 hours. Of course, we have lots of other preparations besides the flower, besides the bud, besides being able to smoke cannabis that are available on the market. They're also, of course, available somewhat on the black market, but mostly that's the loose leaf cannabis, or I'm sorry, flower and bud cannabis. So things like gummies that's shown on the right there, and chocolates, as well as a variety of oils, for example. So this really has to be taken in consideration as well as to like how long cannabis can affect an individual and how long it may affect something like driving. So in general, I've listed here how long, how quickly and for how long different types of cannabis preparations may affect you. And this means all those effects that I've showed before, positive, negative, or neutral. So if you were to smoke or say vaporize cannabis compounds, as I said before, you'll see in onset, you'll start feeling the effects typically within 5 to 10 minutes, and those effects could last typically between 2 and 4 hours. The peak is usually between 10 and 30 minutes, maybe up to 40, 45 minutes, where you'll get peak effects, and then most individuals will notice that the effects are dissipating after that. If you were to take an oral preparation, let's say you took a pill, a gummy, something like that, it would take a bit longer because the compounds have to be absorbed from your gut, for example, so you wouldn't see the onset for maybe 1, even up to 3 hours. And the effect could last for 6 to 8 hours, and typically you might get a peak between 2 and 4 hours. So that's something someone would have to take into consideration based on the amount of a cannabis product they had, when they might be driving, etc. The oral mucosal route, so that is if you take something in the mouth, typically between like in the gums and the cheek, you would get a faster onset, not as fast as smoking, typically within 15 to 45 minutes. But the duration lasts pretty much the same as some, an oral product, so up to 6 to 8 hours, and you might get, again, a peak between 2 and 4 hours. And one thing I've listed at the bottom there is that regular users can definitely develop tolerance to the effects of cannabis. So the effects that, say, a naive user using it for the first time, or maybe haven't used it very often, versus someone that's using it, say, on a daily basis or every other day, can be quite different. So you could get tolerance to a lot of the effects, especially to a lot of effects that I listed to smoking cannabis. So as far as driving, what we're most interested in is impairment, intoxication and impairment. So intoxication is quite extreme. That's when, it's almost equivalent to a poisoning. So when a person's normal capacity to reason, to judge, etc., is inhibited, and we typically talk about alcohol or other drugs. I always say alcohol and other drugs because alcohol is a drug. A lot of people forget that and they say alcohol or drugs. alcohol is definitely a drug, and that's the one we've studied the most when it comes to intoxication and the impairing effects of drugs. And what impairment is a diminished, damaged, or weakened ability, essentially behaviorally, but a manifestation of the nervous system. So for example, with alcohol, blood alcohol content of 0.05% would be impaired, whereas 0.08 is intoxicated, and that would be a legal issue, and you'll hear more about that. I think from Sgt Didham in a bit, and Conahan as well. So I won't go into detail about that. But impairment is basically what we're trying to get at here with cannabis and how it may affect driving ability. So the thing is, we don't have as much information as we should. I mean, cannabis has been legalized in Canada now for just over 3 years. And it takes a while to get good, reliable data about motor vehicle accidents and how much certain types of drugs could be contributing to them. So a lot of the best data we have is actually from the states still, where they've actually had some states that have legalized cannabis, like Colorado, for example, has had legalized cannabis for almost 10 years now, states like Washington as well. And they have found in their evidence that there has been an increase in THC. So that's THC is primarily what's measured, being detected in individuals in motor vehicle accidents. But what does the data actually show? And so the thing is, you have to test this in a way that's like, typically these are, driving simulated tests. These are other tests done in a laboratory, or they may be, in some instances, done in actual vehicles under a very controlled circumstance, but those are very rare. There's a lot of ethics to that. I know of a lab in Virginia that can do that, but they're very, very rare. So you kind of have to simulate things that you might have in driving. So I won't go into details here, but this was a very good review that just came out, just in September this year. So these are cognitive tasks. So that's higher level thinking, for example, concentration, consciousness, basically thinking, and various things that could be affected. So for example, the numbers listed after all these are references in this specific review article that I talk about here. But like your useful field of view. So basically, like if you can take a single glance, for example, how much information can you get out of glancing without moving your head? This is obviously very important for driving. That field of view and the information you can get out of a single glance is diminished with an individual that has levels of THC, for example, in their body. Motor pursuit or tracking, that is something we do in a normal circumstance, not just with driving, but when we could track, say, something like a dot moving across the line. This is like you could tracking somebody moving as you're driving, tracking, say, a road sign as it's stationary. This kind of pursuit is something that's very important for driving, obviously, and that also seems to be impacted by cannabis as well. Estimating time, that is dramatically affected in a lot of individuals under the influence of cannabis, especially THC. That can obviously be pretty important, for example, if you're trying to establish a safe following distance behind a vehicle. So that has been shown to be impaired as well. And I won't go into all these other cognitive effects here, but I'll talk about some that are more specific to driving here in the next slide. So this was looking at, again, driving either in a real vehicle, which is more rare, or in simulated driving tests, and measurements of specific things that you would have to do while driving, for example. So the first things listed here are manipulating steering wheels and having variability or reversing your movement, for example, with the steering wheel. And cannabis was found to have no significant effect on this driving measure. Now, this was done, and this is some references listed here. And again, this was done in mostly controlled circumstances, and a lot of it was simulated driving. Increasing speed or excessive speed, there didn't seem to be an effect there as well. However, there were lots of other things that were definitely affected. So things like going around corners or taking curves, your variability and being able to hold a motor vehicle steady can be altered by cannabis, by THC specifically. Increasing the distance you need to brake, that might be something to do with estimating time. That is affected as well. Deviating from lane to lane, that is also affected. So you'll do that more often, typically, if you're under the influence of cannabis. This one here that says increased collisions or decreased time to collision, there didn't seem to be an effect on that. That being said, at least evidence, the epidemiological evidence shows that there seems to be an increase in motor vehicle accidents. And this, of course, was done in a very simulated way. So it has to be taken into a grain of salt, but at the same time, it showed that, you know, when simulated, there were no additional collisions. And that was like not just hitting a car, but maybe like a road sign on the side of the road, something like that. But also other things like passing other cars, things like that, or once a light turns green, the time it takes you to actually go through the light, those were definitely affected by cannabis. So most driving types of behaviors, things that are essential to driving, are affected by cannabis. And I should say a lot of these are dose dependent. So when they had a possibility of measuring THC and levels, for example, that an individual ingested in very controlled circumstances, they were definitely dose dependent. The higher the dose, the more effect you would see. So how does it compare to alcohol? And the reason I put this in here is because a lot of the motor vehicle accidents, so definitely alcohol increases your chances of a motor vehicle accident pretty substantially, especially if you're at 0.08. And you'll hear more about this, I think, later in the presentation. But a lot of times in motor vehicle accidents where someone has tested positive for cannabis, for THC, I should say, that individual has also been drinking alcohol. So, you know, is there a separate effect? Are they synergistic, etc.? But one thing I want to point out is that the effects of cannabis on driving ability are definitely quite different than alcohol. There are some similarities, but like when someone gets to a level of 0.08% alcohol, and again, that's a criminal offense, that is intoxicated driving, that most individuals aren't aware that they actually have deficits, whereas someone with cannabis is much more easily to recognize it and realize they may be having a deficit. And anybody under the influence of alcohol, that level, can't compensate very easily for those deficits. So it's extremely dangerous, whereas someone smoking cannabis can think about it more and try to compensate. Things like lane position, though, for example, that and being able to stay steady in a lane, impaired both by alcohol and cannabis. Same thing like divided attention or being able to concentrate. Divided attention could be seeing two, you see a green light and you see a car on your right side. You have to be able to do that accurately. Or even listen to the radio and driving, things like that. That gets impaired. Obviously, texting and driving is a big divided attention issue. That's impaired by both alcohol and cannabis. Being able to concentrate. Reaction time is definitely increased with both alcohol and cannabis. But things like risky choice making, impulsive behavior still stays impaired with alcohol, whereas cannabis, it's not picked up as much. And excessive driving speed, you see it a lot more with somebody impaired by alcohol versus cannabis. And most evidence shows that if you combine THC with alcohol, you don't see a synergistic effect where it's, say, multiplied. It's mainly additive. Okay, so certainly don't want to be doing both. And honestly, I would say you shouldn't be doing either of these things while driving, using either of these substances while driving. You're going to hear a lot more about this because I'm not going to go into detail about this. It's something, for example, as I think Sgt Didham may talk about this, but like, how do you measure impairment? Well, with alcohol, it is the most studied drug we have. We have the blood alcohol content we can measure through a breath test. It's not foolproof, but it's pretty close to it. It's the best measurement we have that you can correlate someone's blood alcohol content to how impaired or intoxicated they are. But with other drugs, and I'm not talking just about cannabis, but other things that you may take for granted, things like prescription drugs, like benzodiazepines that you may be taking for anxiety, for example. All of these types of drugs, opiates as well, they're taking for pain, can influence your behavior. And there's a battery of tests that can be done to measure a variety of behavioral manifestations, as well as physiology, heart rate, pupil diameter, etc., that you can match up with somebody to see if they've been using a substance, to see if they do have impairments. However, that being said, alcohol, we know how long it stays in the body. We know how quickly it's metabolized. We can measure blood alcohol content for a while, but with THC, it's different. So again, we think of THC as the major impairing substance because of all the effects it has on the body. But active THC, once it's ingested, gets quickly metabolized. And first there's an active metabolite, and then it quickly gets metabolized into an inactive metabolite, THC carboxyl acid. And that is typically what is measured. And so, for example, if someone is tested, and this could be for driving, this could also be in a workplace environment, Urine can, and this could be urine or blood. It's typically going to be urine. So at the top there was a urine sample, and I've removed names and everything from these. These are from quite some time ago. There's a battery of drugs that was tested there, and the only one that showed up positive was cannabis. And when it says cannabis, that means they're testing for that metabolite of THC. That being said, you don't know what the level of THC was in this individual. It could also be a false positive. So typically you go to a more sophisticated test. So the one that's on the bottom of the screen here is one called LCMS. So that's liquid chromatography mass spectrometry, sorry. And that is much more sophisticated. And what it shows on that test was the actual levels of this metabolite of THC, which in this case shows 32 nanograms per milliliter. So that could be in urine. You can also test that in blood. So what's tricky here is that you need to match this up with the behavioral deficits. But even, let's say somebody doesn't have behavioral test deficits and tests positive, it doesn't mean they were under the influence of THC at the time. So this metabolite can be found in somebody's urine or blood sample for a week. If someone's a seasoned user and they're using for, every day and then they stop, this may be detected for up to a month. So it's very tricky. And also this shows 32 nanograms per milliliter. We don't know the exact dose of THC that is going to cause impairing effects in the human body. We need a lot more data to be able to decipher that. And a lot of it is, and I'll just end with this, is like just again, the way that THC is metabolized and detected. So this shows THC concentration on the left side versus time on the bottom in hours. So this goes up to 5 days. And what you'll see is it gets into the blood and brain very rapidly. So this, for example, if you were to smoke it, you would detect it in the blood very quickly, but it dissipates fairly quickly as well. But it can get into things like high perfusion tissues. So that would be areas that get a lot of blood flow. So areas like the heart and liver have high blood flow. Low perfusion tissues may be like muscle. Well, THC gets into muscles much more slowly. THC is also very what's called lipophilic, meaning it gets into fatty tissues. So as you'll see, it gets into fatty tissues slowly, but it can be maintained there for a long time. Well, someone that's been using a lot of THC, that can leach out of fat and then get into the blood, and then you might have a positive result for THC. So it's tricky to figure out. We have a lot more experiments to do to be able to decipher exactly, what is a safe dose? Is there a safe dose of THC when you can operate a motor vehicle, et cetera, and correlating that with the behavioral deficits and driving deficits. A lot more to do there. So it's just not as simple as alcohol at this time. Okay. All right. Have you kicked me out now and I'm not sharing anymore?
Yes, we did. Yeah, helped
Okay.
you with that.
All right. Thank you.
I have passed the Karen is sharing next. I've passed the presenter role over to her.
Am I good to go?
You are. Thank you.
Great, thanks for the opportunity. I'm going to talk about a little bit of cannabis and function and talk more about what the law says as opposed to elaborating on what Dr. Weber has just indicated. I am going to kind of reiterate some of the information, but keep in mind that my research, my experience is significantly different. So when we talk about cannabis from a policing perspective, and what we teach through our standardized field sobriety testing and drug recognition evaluation, as Dr. Weber had just referenced, is how we determine if somebody is impaired while under the influence of cannabis. And we talk about cannabis, we also talk about other drugs, and likewise alcohol is considered a drug as well. So for our purposes, cannabis is derived from the cannabis plant. It can be grown in almost any climate and increasingly cultivated by means of indoor hydroponic technology. And certainly since cannabis had become legalized here in Canada, from a policing perspective, we are seeing that increase. Cannabis is the scientific name for marijuana. The active ingredient in cannabis is delta-9 tetrahydrocannabinol, or THC, as Dr. Weber has referred to it as. And I'll also break it down into the metabolites as well. From a policing perspective and for our testing purposes, cannabis will also include hash, hash oil, and sativa. Those items are also readily available, and we are aware that people will consume those and operate vehicles as well. As Dr. Weber indicated, THC will break down into two metabolites. One is what we refer to as the hydroxy metabolite, and the other is carboxy. The hydroxy metabolite is the one that's psychoactive at the time, which would cause or potentially cause some impairment to your driving. And the carboxy metabolite, and Dr. Weber, you can certainly jump in and correct me, that's more along the metabolite that will stay in your system for up to 28 to 31 days. And that's often what is detected from our perspective in the urine or in the blood several days later. When we are doing impaired driving and we take a sample of a biological sample for impairment, we are now using blood as opposed to urine, because we know that the blood is a more effective means of determining whether or not they have the active metabolite. And I just spoke about that. So the hydroxy produces that high or impairing sensation, and it remains in your system for hours. And that's if it was just used. And then the carboxy, as I've indicated, it is a waste byproduct. So it doesn't produce high or impaired sensation, but stays in your system for up to 31 days. And that indicates recent use as opposed to impairment at the time of driving. What we look for when it comes to impaired driving is it's a multitask process that we take. We look at a totality of information. So generally what will happen is the police officer will be out on patrol, and they will see a vehicle and the driver is behaving in a certain way or is breaching the Highway Traffic Act under certain sections. Could be driving erratically, could be any number of things. Or we could have a complaint from the public who's indicated that somebody just left a residence or left a party and that they've consumed cannabis. And we would act on that. So usually it's a multi-step process that we have information that somebody has consumed and that they are driving. And then becomes the vehicle stop. And when we do the vehicle stop and we actually speak to the driver, these are actual signs and symptoms that we're looking for at the time of the stop. And this is going to give us a better indication of whether the person is displaying signs of impairment or not. We look for very red eyes, obviously the odor of marijuana if it's smoked, body tremors, eyelid tremors, relaxed inhibitions. Usually when people get stopped by the police, there's certainly level of anxiety is increased. It's not normal that we stop somebody that's just either consumed or has breached the Highway Traffic Act and are completely relaxed. So that's one of the things that we look for. I know in one of Dr. Weber's slides, we talked about paranoia. They could be paranoid, disoriented. The important thing when it comes to driving, and Dr. Weber referred to it as well, is the impaired perception of time and distance. And I have a slide talking about that because that's really what driving is all about, and certainly avoiding collisions, is that you have to be able to have the time to react as well as the distance between you and an obstacle on the roadway to avoid that, whether it's being from steering or braking, those types of evasive actions. We look for dilated pupils and increased appetite as well. I don't think it's any secret to anybody when people have consumed cannabis that, they get the munchies. And again, as Dr. Weber indicated, and this of course depends on how it's consumed. A duration of our effects could be anywhere from 4 to 6 hours is generally what we see as a rule of thumb. It's a guideline and it varies depending on the level of THC, metabolism, how it was consumed, and what the operator's tolerance is. So operating a vehicle with divided attention, and why is it dangerous? Dr. Weber did indicate that if you consume cannabis, then your attention could be divided. And when you're operating a vehicle, you are multitasking. You have to be able to divide your attention. You have to be able to brake. You have to be able to accelerate. You have to watch for obstructions. You may be on your Bluetooth. You may be thinking about work, but you may be thinking about your family. You could be looking behind you at your child in the back. There's any number of things. If you're driving a standard, you have to change gears. Lane changes is another thing that we know that can be effective. So all of these things are actions that you have to be aware of and to be diligent in being able to respond to them in a timely manner, especially if you're traveling, in an area where there's playgrounds or schools where children can jump out in front of you, or if you're on a highway where you're traveling at speeds in excess of 100 kilometers an hour. So when it comes to your reaction time, if you're driving at 50 kilometers an hour and a child comes out between two vehicles on a roadway, you have to recognize the obstacle, formulate a plan to avoid the child, and execute that maneuver. Research has showed that an unimpaired person, it will take anywhere from 1 to 1.5 seconds to recognize that there's an obstruction or an obstacle or something has happened. You have to formulate your plan, and then you have to be able to execute it. And that takes anywhere from 1 to 1.5 seconds. That's going to depend on age. Certainly with elderly people, it may take a little bit longer, but for a general rule of thumb, it's 1 to 1.5 seconds. If you're impaired, that could be actually up to as high as 4 seconds. So what that means is that you could actually have had a collision and not even realize that you had the collision. So when we're talking about reaction time, I don't think there's anything more important than be able to react quickly and appropriately to avoid a collision. And I talked about this as well. So at 50 kilometers an hour, you travel 14 meters per second. So in 4 seconds, you've traveled 55 meters. So you've hit that child on the bike that came out between two cars and have traveled 55 meters before you even have the ability or the awareness that you struck a child or you struck anything. It could be a dog, it could be any number of things. But we also know that it takes a period of time for people to react to that. So what does our law say? So when cannabis became legalized, there was a revision of the not only of the Highway Traffic Act, but also of the Criminal Code. So everyone who commits an offense, who operates or has care and control of a conveyance, and that's a car, a snowmobile, ATV, a side-by-side, anything under the definition of a motor vehicle into the Criminal Code, anywhere in Canada, while the person's ability is impaired by a drug or alcohol. And when we talk about anywhere in Canada, we're not just talking about the roadways. It can be on a trail system. It can be on your own property. Anywhere in Canada, you are not allowed to operate a conveyance or a vehicle while you're impaired by a drug or alcohol. So the Criminal Code is broken down into two sections. One is the summary conviction, and this is a minor offense in the policing world, we'll say, when it comes to offenses under the Criminal Code. So summary conviction for cannabis only is that if you have 2 nanograms of cannabis, but less than 5 nanograms of THC per milliliter of blood. So when I talk about cannabis now for this purposes, I'm specifically talking about THC. So you can have between 2 and 5 nanograms of THC per milliliter of blood, and the penalty, if you have that much in your system, is a maximum fine of $1,000. A hybrid offense, which is a dual offense, it can be either a summary conviction or an indictable offense, That indicates if you have 5 nanograms or more of THC per milliliter of blood, your penalty for a first offense is going to be a minimum of $1,000 fine. So if you get stopped at roadside and we test you and you have more than 5 nanograms of THC in your system, then you're going to get a fine and it's going to be a minimum of $1,000. If you get stopped again, your minimum is going to be 30 days in prison. And 3 or more times being stopped with 5 nanograms or more of THC in your blood is a minimum of 120 days in prison. So I think to reiterate what Dr. Weber has indicated is that we don't have a whole lot of scientific research conducted on people driving that are under the influence or impaired by cannabis. And because of that, the criminal code has taken, or I should say, Parliament has taken a very stern approach to how much cannabis or THC can you have in your system and still be allowed to drive a vehicle. As time goes and we're able to do more research, we may see these numbers change. There's constantly being research done. There's constantly being information provided from the police and from the labs with relation to this. But as it stands right now, this is where the law lands. So one of the hybrid offenses being continued is that, and we talk about alcohol and THC on a regular basis. So if you have 50 milligrams of alcohol in 100 milliliters of blood and more than 2.5 nanograms of THC, your first offense is a $1,000 fine. The second offense is a minimum 30 days in prison. And 3 or more offenses is, again, it's a minimum of 120 days in prison. So the first offense we talked about was just strictly having THC in your system. This one is a combination of THC and alcohol. So if you notice with the first offense, it was between 2 and 5 nanograms of THC. This particular case, the THC level is lowered to 2.5, but it's in combination with 50 milligrams of alcohol. So in this particular case, we would have to do testing for THC, but we would also have to do testing for alcohol. Maximum penalties, they could range from 18 months for a summary offense to 15 years if it's an indictable offense. Now, when we're talking about indictable offenses, we're talking about very serious offenses where motor vehicle accidents and people are injured or sadly, if it resulted in a death. That would be along the lines of an indictable offense. Maximum 10 years if it's bodily harm, and if it's impaired driving causing death, you could potentially receive life in prison. Those are the maximums. So it's illegal to drive drug impaired, and it's just as dangerous as driving drunk. Cannabis, like many other drugs, may slow your reaction time and increase your chances of having a collision. We see that from a policing perspective on a daily basis. I think part of the issue with the reporting of and stats on collisions is simply the reporting and the availability of the information there. So how do we test? So there's 3 mechanisms we have for testing for THC. We are authorized to use an oral fluid screening device at roadside. That's a device that we would use on demand. So again, we would have a reason to stop a vehicle. We would have the signs and symptoms like I spoke about in the early slides. And then I would decide whether or not I'm going to do one of these 3 tests. The roadside screening device for oral fluid is a handheld device. It is a oral fluid swab. So we give a person what I'm going to refer to as kind of like a sucker. They would suck on it, provide saliva. We would test it at roadside, and that will give us a positive or a negative result based on what the cutoff level of the testing criteria is. That would satisfy a per se limit, and a per se limit only. That has nothing to do with impairment. So when I was talking about the 2 to 5 nanograms of THC, that's considered a per se limit. When we're talking about greater than 2.5 nanograms of THC and 50 milligrams of alcohol, Again, that's per se limits. We would test at Roadside for our oral fluid device to see what the per se limit was. If we then wanted to pursue an investigation with relation to impairment, there's two things we can do. One would be a standardized field sobriety test, which is conducted at Roadside. And that's a test, it's a simple test that's performed, and it checks to see if somebody is able to divide their attention. So again, we always go back to, are they able to divide their attention while operating a motor vehicle? And it has to be able to be done safely. The other test that we can do is a drug recognition evaluation, and Dr. Weber showed a sheet for that. That's a much more in-depth test that we would do, or an evaluation that we would do. That will be done back at our headquarters. And there's several different aspects of that test. We look at whether there's a medical condition that could potentially cause the erratic or the behavior that we're observing. There's been several times where we've stopped people that are actually having a diabetic episode. The last drug recognition evaluation that I was called to attend was actually somebody who was in a diabetic shock, and they were unaware of it at the time. And by the time I got to the police station, we actually had the paramedics there checking them out, and they did get medical attention. So we do look at whether or not they have diabetes. We check to see if they have epilepsy, see if there's any medical conditions that could explain what the behavior is that we see. We do divided attention tests again, or psychophysical tests. We take blood pressure, temperature, pulse, because we know different drugs and different categories of drugs will either affect those vital signs, could increase it, they could slow them down, or they may not have any effect at all. So we look at that. Now, we're not, we're trained to take pulse, temperature, and blood pressure. We're not paramedics, far from doctors or nurses, but it's just a very basic test that we are able to do to determine which category of drugs is in somebody's system. Once we complete all of that, then as a drug recognition evaluator, you have to be able to look at the totality of the information that we have and say whether or not we believe, it's in our opinion, that this person is impaired while operating the motor vehicle. And that's going to go right back to what information did the officer have at the time of the stop, what signs and symptoms were observed, which of the three testings, three choices of tests were being conducted, and then what were the results of those. If we have alcohol involved as well, which a lot of times we do, we will also administer a roadside screening device for alcohol, or a breathalyzer test in which we would get a numeric reading. And as Dr. Weber referred to, anybody with over 80 milligrams of alcohol in their blood is considered to be impaired. So those are the three types of testing, and officers are trained to be able to conduct all of those, or most of those tests at Roadside. Then if it requires a drug recognition evaluation, then it would be an officer with specialized training again. So Newfoundland Highway Traffic Act is also a piece of legislation which we will enforce. It's a 7-day suspension. You have to pay a reinstatement fee. And if you're a novice driver, which means if you have 2, 4, 6 months, then you're going to have a driver's license suspension as well. The suspension could be 2, 4, or 6 months, depending. Okay, that's going to conclude my aspect of it from what the law says. I'm certainly open to questions. I'll stick around and open to questions when it comes to actual specific enforcement techniques and that type of thing. Thank you.
Great. Thank you, Karen, for your valuable information. It's really useful for me personally, and I believe for all the audience. And also thank you, Jean, for your science perspective for this webinar. And now I would ask Sergeant Stephen, would you like to provide your input or comment on Karen's presentation?
I think that Sergeant Didham did quite a good job covering all the aspects of the enforcement. The RCMP in the province of Newfoundland and Labrador, the RNC are our policing partners, so we basically mirror what they do as well. And we do joint testing for our DREs, we certify together. So yeah, no, she's done a great job covering it.
Thank you.
Great. So thank you, Pose. And now we're gonna move to the sharing our research team results. And welcome Dr. Jennifer and Delaney. So they're gonna present our team research results. So go ahead, Dr. Jennifer.
Thank you so much, Dina. Yeah, really excited about this webinar today because some of the research that we have been doing this past year has focused on driving and some of the implications and risk perceptions out there. So we're gonna share a bit of that with you today. But just in terms of a bit of a background, I know we mentioned earlier that we're doing a pretty broad cannabis policy evaluation. And to inform that evaluation, early on, we did a needs assessment with a broad group of stakeholders, a large group from the general public to see really what are the priorities and what are their thoughts on cannabis legalization. And we've heard lots of things, but a couple of things we heard from people were that they felt that access has probably increased for youth, that consumption's increased, and that cannabis is probably, more accessible now that it's legalized. And so, those are all concerning, perceptions out there, but the problem is when we did our needs assessment, we didn't hear from youth directly. So what we did is we decided we're going to go out and talk to youth and really hear what is the impact of cannabis legalization on this group in this population. And when I say youth, it's the broader youth of, say 13 to 25, including young adults. So we spoke to them about several issues around cannabis, and today I'm just going to highlight what we found with respect to youth and driving under the influence of cannabis. And while I worked with the rest of the investigators on our evaluation team, it was really important to us when we designed this particular study that we had young adults, like people that were more relatable to youth and young adults out there doing the engagement sessions, speaking, asking the questions, and hearing their responses. Because we've just felt youth would be more comfortable. And that's why I have Dalainey here with me today, because she really spearheaded this research over the summer, recruiting, talking to youth from right across the province. And so she'll be speaking to what she heard, and I'll just be kind of setting the stage, setting up what we did, and maybe talking just to some of our implications there at the end. So if you're going to move to the next slide. Excellent. So in terms of recruitment, oftentimes when you're doing research, it's really hard to find a sample population that really is representative, what we say representative of the whole population. So we worked really hard and we had to get really creative to be able to recruit youth that were not only within a variety of ages, have different experiences with cannabis from different areas of the province. And so we primarily worked with the community youth networks through the provincial government, and these are community groups or community youth networks that are right across the province and into Labrador. We used social media. We had lots of posters and things in post-secondary newsletters for the university and other institutions. We had help from our stakeholder and citizen panels to get the message out. We did what we call snowball sampling, which means that people who knew of other people who might want to share their thoughts could also contact us, and other youth organizations like Thrive in the province. So we had to get creative to make sure that we were getting a good sample right across the province. And we were really lucky. We actually did get a really good representative sample. And so when we say we're doing engagement sessions, these are like focus groups where we were speaking with youth in small groups to get their perceptions on each of the questions that we had. So we were able to recruit 91 individuals, which we were really pleased with. 38 of those were considered youth, so between the ages of 13 and 18, and 53 were young adults between the ages of 19 and 25. And while we'll speak to our findings together, we've grouped them together, when we went out to speak to people, we separated youth and young adults. They weren't mixed together in any groups together. And the other thing that we did was, I guess, a positive thing coming from COVID is that our population is a lot more accustomed to these virtual type events. And so we were able to use virtual technology and Zoom to host these sessions, which meant that we could reach further into the province than we could have if we had to travel out and speak to people in person. And so I think maybe our sample is a little bit more diverse because of that. So that's really great. And now I'll pass it over to Dalainey and she can talk about what we heard, which I hope you'll find interesting.
Awesome. Thanks, Jennifer. Yeah, so I had the opportunity to lead the sessions this summer speaking with the youth and young adults across a variety of topics. And one of them was cannabis and driving under the influence. And so what we heard here were the perceptions of youth and young adults. So you want to keep that in mind when I'm sharing the findings. The most common thing we heard is that driving under the influence of cannabis has become a normal thing in society, especially here in Newfoundland and Labrador. It's not really something that is viewed negatively, and it has become quite common. And as some youth shared, driving impaired is just what they know. So I guess some youth had shared, I've always been driving under the influence, or I know people that learn to drive under the influence, and so it's actually abnormal if they're sober. So quite concerning to hear, but also important for us to hear in terms of public health and safety. So, as one participant shared here, people aren't hiding the fact that they're using marijuana as much where it's legal. You've definitely seen a lot more people out on the roads, and it's not just in the shady parking lot or somewhere like a back road on the way to a cabin. It's even just driving down the crosstown. You can smell it. People are riskier when using it. So it isn't something that people are concerned about hiding, despite some of the laws that are in place or the restrictions that are in place, as we've heard about earlier today. The next thing we heard is that consuming cannabis in vehicles is not limited to the driver and often is commonly seen with the passengers. And so as this participant shared, if there's nothing to be at, people just kind of drive around. And maybe if you're with someone and they're smoking, it's like, oh, I'll have one puff or I'll have a few, and it spirals that way. And so consumption with the driver and passenger together, or just the passengers, seems to also be a common activity, whether it's for recreation, as hinted at in this quote here, or a social activity together. So again, it just further exemplifies the commonality of what's occurring on our roads here in Newfoundland and Labrador. And, one of the things that people said, that kind of may influence their decision to engage in this behavior really was only whether or not the driver would permit it. So young adults would share, if the driver was concerned about keeping their car in good shape, or they didn't want it to be damaged by smoke or smell, that's the only thing that really prohibited them from engaging in these behaviors. The next thing we heard about was the influence of mode of transportation. So we heard from both youth and young adults that it's perceived that the frequency of driving under the influence of cannabis is more common with off-road vehicles than on-road vehicles. So it doesn't mean it's not happening with the on-road vehicles too. They had said that they believe it's a lot more common. There's a lot less second guessing when it comes to the off-road vehicles. And that's what this participant shares here. If you're out to a cabin party or something like that and snowmobiling, or you're on an ATV, it's not even a big deal. It doesn't seem like people even think twice about getting behind the wheel. There's definitely less of that second guessing and thinking about, okay, should I do this or should I not? And when we probed a bit further with the youth and young adults, is why is there less thought of going into the off-road vehicles? There's this perception that there's a lot less harm posed to themselves, as well as others that may be on the back road trails or on the road. For youth, some of them had easier access to off-road vehicles than on-road vehicles, especially if they're not of age to drive on the road. And there's also this perception that there's less enforcement or less chance of them getting caught if they're on the back roads. And so that's kind of what's driving this behavior there. Next, we heard from youth there's a general lack of awareness and knowledge around the true impact of cannabis on their driving ability. And even if they are aware of what the research or what people are stating, they feel that what's stated is overstated. So it doesn't really match with their experience when they've driven, or they know of other people that have drove under the influence of cannabis. And so a lot of people, as Dr. Weber had briefly touched upon, also shared that they believe, after I consume cannabis, I'm a lot better driver than when I don't. don't consume. And so we also hear that we have organizations like MAD that show the really graphic and emotional videos of drunk driving, but we don't really have that for cannabis. So the government is just trying to piggyback off the drunk driving campaigns and say the same thing about cannabis. The information isn't really out there in the same way. And so as this participant highlighted, the MAD campaigns really stick with them. It's emotional, it's relatable, they can really relate to the content, but they don't feel like that's out there for cannabis just yet. Then we also talked about perceptions of risk, and this was always quite a fruitful conversation when youth and young adults alike would share how they perceive the risk of cannabis in driving. And so overall, it was shared, that driving under the influence of cannabis is safer than driving impaired by alcohol, and it's also more socially acceptable. So that was an interesting thing that came out in our sessions regardless of age, and that driving impaired by alcohol was never acceptable. But cannabis, as we've seen earlier in the slides, wasn't something that people really think too much about. So we see here from this participant, I think people think that weed or marijuana slows them down, so they're going to be more careful, whereas alcohol makes you more impulsive and not as careful. I think that might be the perception that some people have had and why they make the conscious decision to drive under the influence of weed. We also heard things like, I definitely don't think it's the same level of danger. I trust people like men who have cars and drive high if they've been smoking weed for a while, if they have a lot of experience with this. So this is something that Dr. Weber touched upon earlier, the idea of tolerance. And so although individuals that consume cannabis on a regular basis may become more tolerant, I think it's really hard for youth and young adults to judge, has this person reached that threshold and how does that impact them? And so we can't just go on the basis of this person consumes it semi-regularly to go, okay, this is a safe person to drive with. So it definitely needs some education there on what the tolerance means and how that may come about, like we learned today. We also heard things like males are more reckless and females are more careful. Males wait shorter duration after consumption than females, or males are last minute planners versus females who plan ways home in advance. And so we did have a large number of females in our sample. However, it's important to note that sometimes these sentiments were shared by the male participants themselves, or they would be quick to say, yeah, I agree with that. My friends or my buddies do that too. This is what I've seen. And so that's another thing to consider if there's some gender differences in the driving behaviors we see. The last thing we heard from youth was detection. And so the first thing we heard was that detection is hard for the general public. Unless someone has explicitly seen the consumption of cannabis by their designated driver, the person that's going to drive them home, it's really hard to know, is that person impaired by cannabis or anything at all? And it's not often that the individual is going to explicitly share, I'm impaired, but still get in the vehicle. And so that's what this quote shares here. I think with alcohol impairment, it's more obvious. And you can prove it. I know you can prove it with cannabis as well, but with cannabis, it's like a mental thing where you can kind of snap out of it and pretend not to be high and fool people around you. So again, this is the perception that is out there, and this is what people are thinking. And then there's also concern around detection by law enforcement. So as this individual shared, we have a couple RCMP here in our jurisdiction if we get them to come by every now and then on a long weekend, or they'll pick a weekend to go. And so this really came out in discussion between the rural and urban youth, where, the urban youth would say, we know they're out on the road, maybe that's why we go the back road. And for rural youth, they would often share that, we know when there's police presence or potential to get caught. We know when the person's there, people will send out messages or share that so-and-so's doing their route, this is where they are. So people stay off the road, which is great. Off the road, they're not doing some harm, but then they get the notification that they're out of the jurisdiction now, they're not on the roads, there's no threat to be caught, and so now we're back to driving impaired on the road. And so that's something to keep in mind. And I'm a great advocate, and I value a close-knit community. So it's good we can work together to increase safety, but there's also some risk going on. And some rural youth would share, we know that they can't test us the same way that other urban jurisdictions may happen. And again, that's a perception. Maybe they can be tested the same way. It's just not the belief or what they're aware of currently. So really important to keep in mind with the thoughts that are going on with our youth and young adults. The last thing that came up was cannabis-related peer pressure. And so this really came about in discussion about driving under the influence of cannabis. And so at this quote here, we have, there's people out there that probably conceal it because they don't want to disturb anyone, or like my parents will get mad if I call them, they don't want to pay for a cab. Maybe sometimes people just get in the car if a friend is driving, and then you decide to get in because you probably trust them. They probably tell me if they're high or not, but sometimes they could just hide it from you and you wouldn't even notice the difference. And so I think this quote from the participant really brings together everything that we heard across those themes there, and really points to pressure to engage in driving impaired. So youth and young adults shared if they're like the first individual in their peer group to be able to drive, or the only individual that has access to a vehicle, the pressure's really on now to drive impaired because they need to get the individuals home. Maybe they can't afford a cab that was mentioned, as they can be quite pricey, or there may be repercussions if they do reach out to their parents. We also heard that in rural communities, it's just going a short distance. And so if you refuse the ride home from someone, it's viewed quite poorly and may have some ramifications for your social status. And then lastly, in some communities where they feel that there's a lack of policing or a chance of getting caught, they're also known as a wimp when you refuse to drive, or there's kind of, again, social ramifications if a passenger says no. You're supposed to trust your peers, and now it becomes an element of like, why don't you trust me? Why won't you get in the vehicle? I would never harm you. And so there's a lot of pressure to accept the rides as well. And I'll pass it back on to Jennifer.
Thanks, Delaney. I think it's obvious that there's some really concerning behaviors out there among youth, and just a lot of misconceptions. And I think, we spoke to youth and young adults specifically on this topic, but I think it's fair to say that the literature out there kind of supports. So this is like common thinking among the broader driving population, some of these misconceptions and behaviors. So quite concerning, and I think, definitely needs to be addressed. And I think it speaks to the broader need for education across society, not just only among youth, but, across all members of society, so they understand, what are the implications of using cannabis and then driving. So I'm just going to speak quickly a little bit about education and what we heard from youth. We actually did quite an in-depth look at cannabis education in general. So we have a lot of interesting findings on this topic, but I'll just share specifically kind of how it relates back to driving and maybe some things we can do to improve youth education here. So the first thing is that there really is a lack of cannabis education for youth and young adults. There's fairly little being learned at home. There's some information at school, but it's not really reflective of cannabis being legalized right now. And it's mostly abstinence-based, which means it just kind of scares youth and young adults from using it at all. And therefore is not really providing the education they need, that if they are going to consume it, how do they do that safely? And what does that mean when they have access to a vehicle, or they have access to getting in a vehicle with somebody else? They really can't make those informed choices because the abstinence approach really just focuses on don't do it. And what's concerning is that youth are learning most of what they know about cannabis through peers and social media. And so you can imagine this is generally very positive. It's based on their own personal experiences. So if they've never had an accident, they think there's no harm in it. There's a lot of peer pressure out there. And so the education that they are getting certainly isn't balanced. It certainly isn't evidence-based. So that's really concerning. The second issue was looking at safe consumption practices. So this gets on to this harm reduction piece. They don't want this abstinence approach where they're just told, don't do it. They want to actually understand if they are going to use it, what are some safe ways to consume it? How do you safely consume it? How do you prevent harm to yourself and others? And they're really not receptive to this deterrence education. Just don't do it is not something they want to hear. They want real knowledge to make it real informed choices. Specifically on the impact of driving and the education they receive, they don't want things piggybacked on alcohol. And I think we heard this earlier with Dr. Weber and Sgt Didham that, alcohol and cannabis, though there are some similarities, there's lots of differences too. And so when we're talking to the public and to youth, we can't just piggyback the same stats on when we provide that education. Things need to be specific to cannabis, and maybe even looking at the different impacts to expect between different cannabis products. So we heard about the, maybe up to 160 different cannabinoids that could have, have active effects on the individual. What are the different impacts that might have? What's the impact of tolerance that we talked about as well? We know that people can build tolerance. How does that factor into the equation? They want real concrete evidence there. And then finally, what's really great to hear is that they want evidence-based information. And so they want to know the science. They want to know how is the impairment detected, and they want evidence before they're actually going to change their behavior. So we have a real challenging situation on our hands because the poor decisions, the misconceptions, and the behaviors of using cannabis and driving are existing, and they need solid evidence before they're going to change those behaviors. And so we have an uphill battle, I think, to face, but knowing that they're going to be receptive to that information, hearing from Dr. Weber some of the new evidence and new summaries of evidence around cannabis and driving, I think is really hopeful that maybe we can get that in a meaningful way into the hands of youth to be able to help them make those informed choices. And I think just remembering too that, we have a long way to go. Like, we know a lot about alcohol and the impacts on driving, as was mentioned. Alcohol is also a very simple drug, and cannabis, not only do we not have much information, but it's a very complex drug, as we've heard about. And I think there's a lot we need to learn, a lot we need to differentiate. So there's a huge gap to fill, and I think we have a lot of work ahead of us to get this, to develop this information, develop the evidence, and get it into the hands of the people who need it. So thank you, everybody, for listening today.
Thank you, Dr. Jennifer and Dalainey, for this useful, valuable information. This is really very useful for me, and I believe for the audience as well. So now we're going to start our Q&A session. So feel free to post your question in the chat box. And so again, I just start our discussion today with as we hear, like for Dr. Weber and Sgt Karen and Stephen. So as we hear from the result of like research team, what do you think about like a lack of awareness and risk perception that we just heard from this research? Do you have any what do you think? Do you have any input or comment on that?
I can start there.
Yeah.
Sadly, what we're hearing is not new information to the policing world. We've known for a very long time that the best approach is through education, and the second best approach is through deterrence. We know through research with policing that if there is no deterrence, then the likelihood that the behavior is going to continue, and the deterrence has to be somewhat significant. When it comes to the evidence-based science, I'm so happy to hear that. I reiterate the importance of that, and I'm glad that we have a generation that's coming up looking for that information, but unfortunately, it's just not there right now. We've been studying alcohol and its effects since the 1940s, and the paper that Dr. Weber presented just as of September of 2021, that's the first real, I guess, paper or information that I've seen, which is supporting, I think, what the young people need to hear. So it's not new information. I have been saying, like I said in our introduction, I've been policing for 27 years, and I can safely say that for 27 years, I've heard MAD say, don't drink and drive, don't drink and drive, don't drink and drive. I think finally that message has gotten out. I'm just fearful that it's going to take another 25 years for it to get out about don't drink, don't do drugs and drive. It's a long time to change that behavior. And if our youth are participating in that behavior now, I don't see that changing simply because they're provided with information. I think once they have the behavior and their own experiences are going to prevail, it's going to be the generation that starts learning about this is where the behavior is going to change. We've known for years that youth have been consuming drugs and driving, whether it's off-road vehicles or not. Sadly, the risk of injury on off-road vehicles is significantly greater than in a motor vehicle from my perspective, because you have less protective equipment. We have no stats on accidents with youth and off-road vehicles. It's just not gathered because it's not being reported to the police. We know with motor vehicles that it is being reported, but youth is not being reported. So we have no idea of how many accidents there are involving youth that have been consuming.
This is very good point. Yes, youth is really important issue. So, Sergeant Stephen, do you have any like a different opinion or different input to share with us?
Sorry, can you hear me?
Yes, now you can hear.
Okay, yeah, no, I agree with everything that Karen has said. Just like to address some of the things. You're right that there's needs to be more education around it. There's not enough science. Thank you, Dr. Weber, because I really enjoyed the fact that that study came out recently, and I'll be reading some more on it myself. The perceptions, obviously, the RCMP polices the rural parts of the province. And I just want to say that there is some validity to what the young people are saying about when you go, there's a difference between rural and urban policing. So in the rural areas, sometimes there's only one road in and one road out. And so when officers are doing the patrols, you're right, as much as it's a great thing that community comes together to share things and whatnot, that's an obstacle for us. Because when we go into a small community, I used to police 2 islands, and I'd get off the ferry and everyone was on their best behavior the minute I got off of the ferry and I did my patrols. And as I was departing from the dock, then the behavior, goes up again, sort of thing. So they're right that they can tailor their behavior on our patrols in some of the rural areas for sure. And I would also say there's validity to how much they're seeing us, because I don't think we have that visible presence as much as we used to. Part of that is resourcing challenges, and some of it is based on some new policies and procedures that have come out. Years ago, we did 1-person patrols. So if there were 2 officers that were on during a night shift, then the 2 officers took separate vehicles and went to separate communities. Now, for officer safety reasons, typically they double up, and so you have 1 vehicle on patrol, so you get less geographical coverage, as opposed to what we used to see. But certainly from the education standpoint, some are aware that across the country, they implemented cannabis specific educators. And so we've actually got that in the process. We even selected a person. He's a retired RCMP officer, RNC officer, was a DRE instructor. That's just going through the process now of getting a security clearance, because he hasn't been working in the federal government building for a while. But very soon he'll be going out and he'll be doing cannabis specific education across the province. So we're actually quite thankful for that. On the broader scope, we have a drugs and organized crime awareness coordinator, as well does the Royal Newfoundland Constabulary. And of course, they're going to make their efforts to do more cannabis specific education as well. And I think that I'm glad that the youth made a very valid point, is we just can't piggyback on some of the stuff. I was involved with MAD. I was on the board of directors years ago. You're right. It can't just be a standard piggyback. There needs to be empirically based stuff that we can roll out to the youth. So that would be my submission.
Very good. Yes, you touch really important point for like covering like geographical location and like your urban area versus rural areas. But come back to the education and public awareness. I would ask Dr. Weber, how long do you think it will take to get evidence we need to adequately inform society on the impact of cannabis on driving? So do you see evidence developing more quickly now that cannabis is legalized?
I think what I would say in a hopeful sense is maybe within 5 years, but I think in a more realistic sense, it might take a decade before we have enough studies done where we can have more like reliable measurements of, for example, THC levels or at least metabolites of THC in the blood or urine to dictate what really is a good level of impairment, as well as things like matching that up with behavioral impairment as well. So I mean I'm involved with the study that's starting to do those impairment studies now. It's just that, yeah, with more funding available to do these studies and obviously the need for it, because as we just heard, like the perceptions of it, cannabis being a safer drug than something like alcohol and getting behind the wheel of a car. It's imperative now, is if there's going to be more people doing this, or at least perceive that more people are doing it, and potential for more motor accidents, that I think that will increase funding even more. And I think the last point I wanted to make is, this discussion of educating youth. There are still a lot of adults with misconceptions, and we have to somehow educate adults as well. I mean, I have lots of relatives and friends that are cannabis users, and many of them have been users for many years, and often some of them have misconceptions about how impaired they might actually be, and before they get behind the wheel of a car, and how long they should wait after, say, smoking a joint, that kind of stuff. So it's very important we educate our youth, because that is going to affect them for a lifetime, obviously, but adults need to be made more aware of effects of cannabis and substances in cannabis as well.
Great. So my next question, just to follow the discussion. So if there is any guidance on the dose of cannabis and the length of time before driving, similar to what we have for alcohol?
No, I just like those guidelines that I mean, I showed how long cannabis can affect an individual, and I think Sgt Didham had shown that as well. So there are some individuals where the effect of cannabis is really gone after 2 hours, especially with a seasoned user. But most individuals will be affected in some way for up to 4 hours, some even 6 hours. But I think the vast majority of the population is going to be affected if they smoke cannabis up to 4 hours. So I always tell people to wait that long, quite honestly. It's just better safe than sorry, not just for whether or not you're going to be legally responsible for an issue should it arise, but being unsafe to other individuals on the road. But also with oral medications, I tell people to wait 8 hours. It's just not worth the risk. Especially if you don't know how it's going to affect you. So I think that's very important. And I think with tolerance, a lot of people will say, well, I'm tolerant to the effects of cannabis, but it's really, I don't think it should be up to that individual per se, or, to decide that, you have to be able to measure impairment in an individual that has tolerance as well. And we need more studies like that. And also another issue that comes into play is medicinal cannabis and medicinal cannabis use. So if someone has been taking medicinal cannabis for years, then they may be very tolerant to it, and they be able, maybe they can get tested while driving in a very controlled circumstance to show that they're not impaired. In those very specific cases, maybe tolerance can be shown. And that's also, you probably heard about this a couple of weeks ago, as a human rights issue. If someone is on, needs medical cannabis to be able to treat various ailments, should they be allowed to drive? That's a whole other issue. So that's my old general scope about how long someone should wait before driving, how tolerance should be dictated, etc. We just don't have enough information to make blanket statements right now, except for like always, I would wait at least 4 hours if you smoke it, and at least 8 hours if you're taking an oral preparation, just in general.
Great. And to continue, like in regards to like people or youth perspection, so a question for Dalainey. When you spoke with youth, did you notice any difference in perception between different demographics, like age, income, urban or rural status?
Yeah, so the urban and rural stuff I kind of presented in the presentation. I guess one thing, if we're thinking about the commonality or the perception of how common these behaviors are, with age, young adults would share, they have to, if they're renting and they're not living at home, like many of the younger youth were, they need to find an alternate location to go consume the cannabis, which means they have to drive or get some way of transport there, consume and find a way home. And so that, again, poses a public health and safety risk. And so that often comes for young adults when they're not living at home, they're renting and it's not permitted on the property that they're living at. Whereas a lot of the youth shared, they're frequently consuming at school, but also at home. And that was one of their top 3 places they had mentioned. Whereas for the young adults, at home was not the #1 spot. It was everywhere but. So again, you might have some differences in the perception of frequency. Regardless, still pretty frequent, but just an extra consideration regarding age.
Great.
I think too, Delaney, when we think about age, is that some of the younger youth that we spoke to aren't actually old enough to drive a vehicle yet, and so that
Yes.
kind of impacts the mode of transportation. So they might be more likely even to use the off-road vehicles versus their on-road vehicles, just because they don't have access to a car.
Yeah, and same with socioeconomic status or access to funds. That also influences, do they have access to a vehicle? Is it their own or is it a parent's? Or do they have access, like in that one quote, are their parents willing, do they have the funds themselves to pay for a cab or an alternate way of getting home? So definitely some differences there, but not measured through our demographics, just through the conversation.
Great. And it's just a question just to see what's the difference before and after legalization. So for the surgeons, have you have there been any changes in amount or a type of driving offenses related to cannabis industry in the past 3 years, like since legalization? Do you notice any difference, or have there been an increase in cannabis use and driving since legalization? This is a question for Karen or Stephen. Do you notice any differences
Okay.
after legalization?
I'm aware that there is an increase. The issue is the detection and the testing for it. I understand one of the misconceptions is that the RCMP may not be able to do the same testing practices as what the RNC are, the Royal Newfoundland Constabulary. As Staff Sergeant Canahan mentioned, our training is together. So what the Royal Newfoundland Constabulary are trained in, the RCMP are trained in. I train RCMP officers and RCMP officers train us. So we all have the same skill set. Ultimately, it comes down to whether or not they're getting caught. And we just don't have enough research. And the other aspect of it is a lot of times we'll have polydrug use. So it's not just cannabis. And then if there's another drug that they've consumed, that drug is much more easily measurable, and the signs and symptoms are easier to detect. So we know that it's happening. It's just catching them is the issue. And Dr. Weber had talked about medicinal marijuana, and I appreciate that, and I applaud anybody who takes medication for any sort of illness that they have. But it's not just medicinal marijuana that can impair your ability to drive. Sleep aids, different sorts of stimulants, different mood altering drugs can also impair your ability to operate a vehicle as well. So we don't just focus on medicinal marijuana. If you have a prescription and your prescription bottle says may cause drowsiness, then you shouldn't be drowsy when you're driving. If the pill bottle says do not operate heavy machinery or equipment, then you shouldn't be operating a vehicle that is heavy machinery or equipment. I'm probably one of the very few people that I know that actually looks at the information packet that the pharmacist gives me and looks at what the indicators are. But if you actually looked at them, you would never take this medication and get behind a wheel and potentially put somebody in danger. I've reiterated several times that these are deadly weapons. We are putting impaired people behind the wheel of a motor vehicle. Would we want somebody who was impaired or high on cannabis and other drugs out in our cul-de-sac yielding a knife or yielding a gun? Society would not accept that. But yet there seems to be a certain level of acceptance when it comes to getting behind a motor vehicle and driving, and it is just as deadly. We have more fatalities due to motor vehicle accidents than we might do at the hands of other weapons.
Great. Steve, do you have any input in the same question?
No, nothing to add there. I agree with Karen.
Great. And the next question linked to the same idea, I have question here for, do you find it's harder to detect now that people are using more cannabis types like edible or oil? So something like a different type of usage, do you find it could be more difficult to detect?
The signs and symptoms that we look for are the same. It just depends on when the onset occurs. And as Dr. Weber presented, and we talked about whether you take it orally because of the digestion process and having to get into the bloodstream that way. So you may have smoked a joint and you're going to see the peak effects much quicker than what you would if you had consumed it orally. So that is going to impact at what time you're driving your vehicle impaired. I still look for the same signs and symptoms, and you have to go back to the fact that I either stop a vehicle for a breach of the Highway Traffic Act or for some reason, or somebody has called in about the person, then I conduct my investigation at Roadside and look for those signs and symptoms that I talked about, and then I go on to testing. If they have consumed and they're not impaired, then our testing stops there. It's the same as with alcohol, is what we're finding is that some people, just because you have a glass of wine or just because you have beer does not mean that you meet the per se limit or that you're impaired. Just because you've consumed cannabis does not mean you're impaired. And that's information that we just still don't know. So that's why we're getting into the psychophysical tests, the divided attention tests, to see whether you're actually impaired within the 2 hours of driving the vehicle. So the criminal code is very specific about timelines, and I don't want to get into that because it's too complicated, but the code is very specific when it comes to timelines as to when you can test, when you can't test.
Great, very good. And this is actually a valuable point to start research like these gaps. So now a question for Dr. Weber. Do we know how much the impact of various cannabinoid on driving, like other types like CBD or CPN or CC? Do you know the impact of these different types of cannabis?
The simple answer is no, we don't. Like THC is by far the substance that has been studied. So like this review article I cited in there, of all the studies basically included in there are looking at THC mainly. And in some cases, yeah, cannabis has been smoked, but the assumption is that it's THC that is causing the impairment. It's going to take, when I say 5 to 10 years, and hopefully we get a better idea of levels of THC or, a metabolite that can be measured. It's going to be even longer than that to figure out other cannabinoids and terpenes and how they may affect impairment. So, and this has already been alluded to. Yeah, it's just not as simple as alcohol. We have alcohol as a single substance, whereas if you ingest cannabis, then it's a multitude of compounds. And I think it's pretty well accepted that THC is the major impairing compound found in cannabis. So yes, others could cause impairment as well, but I don't think we're going to get to a point in the near future where we focus on anything but THC. I think we got to focus on THC first.
Mm-hmm. Mm-hmm. Great. Great, and just a note for the audience. So we indicate that we feel free to go if you have like any other appointments. But the panelists have generously agreed to stay a little longer in order to answer more questions. So we still have more time with the panelists. Just to cover the point of having different type of cannabis and the impact of that. So questions for Karen and Steven. So practically speaking, how often are people being tested for THC, like either in the blood or saliva? So do we able to charge people with driving offenses, or are these tests available on all the jurisdictions? Yeah. So how often we test people for THC?
So we don't really know what the impairing substance is until we get a result back from the RCMP lab. So the process is that we would conduct the applicable test, whether it's a standardized field sobriety test, then a drug recognition evaluation, or an oral fluid device test. Our ultimate goal is to get blood and send it away to the RCMP lab for analysis. We're not getting our results back in a timely manner. We'll say simply because of resource issues. So at this stage, it would be inappropriate to say how many charges we've had due to cannabis alone, because there is a testing procedure put in place. I can say that we respond to potential impaired drivers on a daily basis. And I also can say that I have conducted drug recognition evaluation tests on people that we believe to have consumed cannabis that have not been impaired. I can also say that I have done breath tests on people that have not been impaired and have not met the standard of 80 milligrams of alcohol. So there isn't, the testing is somewhat, I'm not going to say subjective, but it's subjective to the officer's level of comfortability in conducting those stops. But every day we're doing checks, and every day we're doing stops for impaired driving.
Very good. So next question goes to Dalainey. So what does the research say about the perception of driving under the influence of cannabis for those who are older than youth or young adults?
So Dr. Weber kind of mentioned this already, but there's quite a bit of research out there now that would say anyone above, like we looked at age 13 to 25, but there's research out there saying that the perceptions are pretty much the same. So I'm on another study that looked at individuals 18 to 65, and it mirrors what we heard with the youth and young adults. It's still the perception that cannabis is a safer substance to be under impairment of than alcohol, and that it's more socially acceptable, and that also maybe what's influencing some of our youth and young adult behavior. If it's a behavior that they've seen in the home or is something that they know their parents or siblings are doing, then it's also seen as acceptable within that unit or their social settings. So something to keep in mind, but that what we're hearing from misperceptions from young adults from the literature I've read mirrors exactly what we're hearing from youth and young adults. So as Dr. Weber shared, we have to educate the broader age group as well. And I think that will also support in the future kind of the decision making we're seeing with the younger generation, because we're learning from everyone around us.
Mm-hmm. Okay, very good. So just to address the peer pressure for also younger generation. So what kind of role do you think peer pressure has in youth driving under the influence?
Yeah, so I think going back to that slide that I had earlier with the peer pressure, it's just pressure to get home and drive. So again, if you're that designated driver and you have consumed, but if everyone's consumed, then who's going to operate that vehicle? If you're the only person that can drive, then the pressure really is on because everyone's depending on you. Similarly for youth trying to get home. So if you're a passenger, if you can't afford a cab or you can't find an alternative mode, maybe your parents aren't able to pick you up, maybe they're under the influence of a different substance, there's pressure for them to just to get home. We don't know the ramifications they may have from being out late or not returning home, or as that one quote said, I'll have mad parents if I call. So pressure to get home on either side of the driver and passenger.
Great. We also have very interesting questions about like off-road cannabis use. So a question for surgeons, is it surprising that there is a perception that off-road vehicles use is more common? So what's the RNC or RCMP doing about off-road cannabis use?
So the first thing that we have to look at with the off-road cannabis use is the ability to put officers in those locations with the testing devices. The testing devices are there. It's simply about detecting them, having police officers on those trail systems, stopping people and checking. The testing mechanism for off-road is the same as if it was on the road. It's simply having the presence of the police there to act as the deterrent and or to act as a testing agency or a testing agent. We conduct patrols in the Northeast Avalon jurisdiction all the time with ATVs and dirt bikes. And, you know, we've certainly, and I know the RCMP are certainly working on projects. Off-road bikes are an issue, whether they're impaired or not, to be honest with you, and the behaviors on those bikes. So it is about having the presence of police there. But sadly, I think we need to be able to self-police. I think parents need to take responsibility to make sure that the children are using these off-road devices in a safe manner. And if they don't think that they should be driving a vehicle, whether it's off-road or on the road, while they're impaired.
Great, and here is like as a quotation like from research results. So since legalization, I commonly smell cannabis from vehicles. So what are your thoughts on the incidence of passengers' use of cannabis, and how do we change this behavior?
I don't think it's just the passengers that are actively smoking and driving. To be honest with you, I'm an avid walker and I smell it quite frequently as well. You're not allowed to consume cannabis and drive. The Liquor Control Act, which is a provincial legislation which covers the cannabis in vehicles, cannabis is not allowed to be accessible by the driver of the vehicle. So there shouldn't be people actively smoking in the vehicle with somebody operating the vehicle. It's just not supposed to be there.
Mm-hmm. Great.
So in that particular case, then the police would stop them and then issue them the appropriate tickets or charges, whatever would be applicable for that particular offense. But cannabis is not allowed to be accessible to the driver of the vehicle.
Is it the random testing for cannabis impairment?
Sorry?
Is it like there is a random testing for cannabis impairment?
So we have the authority to stop any vehicle on a roadway without reason. But I think that would potentially convolute processes that we have already established through case law to do that. You know, the rule of thumb in all policing agencies is that we can stop a vehicle without a reason. But if you're going to pursue an impaired driving investigation, then you need to have a reason to pursue that investigation. I would not stop somebody and give them a demand to take an oral fluid sample for cannabis if I didn't have a reason to think that they have consumed cannabis.
Mm-hmm. Mm-hmm.
I think that would be a slippery slope. Yeah, that's a slippery slope to go down. Yeah,
absolutely. Yeah, no, we'd have to have a reason to pursue an impaired, and so we wouldn't be doing random testing.
Great. And the next question for Dr. Weber, how much THC approximately would give to the 5 ng level? And is this the inactive metabolic or THC itself? And if someone is using it nightly, how likely do they always exceed this limit? Is there roadside screening or only tested if clinical evidence of impairment? So it's like around 3-4 questions together.
Yeah, as far as amounts, again, it's highly variable. So it's just like alcohol. So if you have someone that's, I'm not just like, it's similar to alcohol in some ways. So if you have somebody that weighs 70 kilos versus, 120 kilos, and they have the same amount of alcohol containing substances, the person that weighs less, of course, is going to have a higher blood alcohol content. So that's one of the first things. If for example, people of different size, different weight, smoke the exact same, let's say the exact same amount, let's say it's the same strain, the same joint, then the person that is larger should probably have less, nanogram per mil in their blood. However, if that individual uses cannabis more often, then they could reach that limit more easily because it could be stored in, say, fat tissue and it's leaching into their blood system. That's what makes it so complicated. I think Sergeant Didham had talked about this earlier. Yes, we have these levels, like for example, 2 nanograms to 5 nanograms per mil. And also, there's some, like for saliva testing, we're suggesting 10 nanograms per mil. That is based on very limited evidence we have that that could cause impairment in a lot of individuals. But for example, it's very hard to predict. Like you can't say, for example, exactly like it's just because you have, for example, cannabis strains that say have 24% THC versus 5% THC. And if you smoke 1 gram of that versus, half a gram, it makes it very complicated. So all that information is based on the limited studies out there and what can cause impairment as in nanograms per mil in blood versus or urine versus like a standard breath test. So you can't say unequivocally, I think, what level is if it's causing impairment. And that's why I think it's really important that it has to be matched up with behavioral deficits. And I think, just like you heard from Sergeant Didham, like she's not going to pull over somebody unless there's reason to do that. And then even then, the person may not actually be impaired, even if they've used cannabis. So it's a combination of all those things of having marked behavioral impairment and levels that we think are correlated with that as far as nanograms per milliliter in blood. And also it's going to change. I expect it to change. And that was commented on earlier as well. I grew up in the United States in the state of Michigan, and now the levels of intoxication impairment are the same as what they are here. For example, 80 milligram percent or 0.08% is considered driving under the influence. It used to be 0.10. So it used to be slightly higher. It used to be 100 milligram percent. But as more data became available that showed that people with, slightly lower amount, 80 milligram percent of alcohol in the blood causes significant impairment, the laws were changed. And I think that's likely going to happen with cannabis as well as we get more data on metabolites and levels of THC. And again, that's typically the active inactive metabolite that is going to be found because of the breakdown and the time that it's broken down. Within the 10 to 40 minutes, most active THC is going to be converted into the inactive form. And that's why you start losing the effects of the cannabis over time. So I think that's going to be the most reliable mention until you get very reliable tests for, the intoxicating, I should say, types of THC. So that's my overall comment on it, that it's very complex and it's too difficult to say anything with certainty right now.
If I may jump in there,
Oh yes,
my
please.
rule of thumb that I say to people is if you have a question whether you should consume and drive, then you just shouldn't drive. Simple as that. As soon as your mood starts to change and you are no longer acting as you would normally act in a work environment or in a school environment, in a home environment, when your behavior changes, then you shouldn't be driving. If you have to question it, it's simple. Just don't do it. And that has to be, I think, at this stage, without having the valid research behind it, that has to be the rule of thumb that we go with. For the oral fluid screening devices, there is a cutoff level much higher than what the statutory limit is. And just because somebody reaches the statutory limit doesn't mean they're impaired. It means that they've reached the statutory limit. And that testing is significantly higher than what the per se limit is. And the test is testing for the active metabolite in THC. And that test is almost similar to, just to keep it really simplistic, it's very similar to a pregnancy test. When you urinate on a stick, there's certain hormones that are going to be present to indicate that you are pregnant. When it comes to the oral fluid device, when we insert the test cartridge into the instrument, it is looking for the active metabolite in THC. And if the inactive metabolites are there, then the test will come back as negative. If the active metabolite is there, it will come up as positive. Because it's generally used within the first half an hour, if we stop and we could administer that test right away, that's probably the most accurate test that we're going to get. By the time I, as a drug recognition evaluator, can get to that person to conduct that test, it could be up to an hour or two. And as we've heard, signs and symptoms are going to dissipate, and all I'm going to get in the urine is going to be an inactive metabolite anyway. So it's a very, very complicated process. And I think because of that, we just have to err on the side of caution and not do it. And I think parents have to take responsibility, and youth have to take responsibility that when you don't feel they're 100%, when your mood has changed, then you just shouldn't do it. It's not worth killing somebody over the peer pressure. It's just not worth it.
Great. And question, yeah.
I was just going to add, I think it's just really unfortunate that, the evidence takes so long to develop because, those behaviors are ingrained out there now in society already, and it's just going to be such an uphill battle. And you're right, like we should err on the side of caution, and people shouldn't, just make the safer choice, but it's just not what we're seeing out there in society, and it's going to be a struggle.
Yeah.
So great point, and the questions that go to surgeons like Karen and Stephen. So it was a great to see some concrete numbers on the reaction time and the potential impact on driving and collisions. What do you think is the best way to get this information out into the hands of cannabis consumers?
MAD is certainly taken the lead when it comes to impaired driving. I'm aware that when this legislation was passed, the federal regulations were changed and the laws were changed, that the federal government did have $180 or $189 million put aside for cannabis research, for cannabis education, for police training. We have certainly availed of a lot of that. The government has done some information sessions with it. There is a program that the RCMP and the RNC do present called a DARE program, which does have a component of cannabis use in it, as well as alcohol use for education purposes. Any opportunity that we have to participate in forums such as this, we take advantage of it. But I really think that the government needs to develop a program to get into the schools in conjunction with policing, in conjunction with the school districts, and we need to get at young people where we're able to get, the largest audience that we possibly can. And I think we're going to need to focus on schools, because that's where the behavior is going to change. I don't think we're changing behaviors of 30-year-olds unless something drastically happens. I think it's got to start off with youth.
Great. Stephen, do you have any opinion on that?
Yeah, no, I agree with Karen. That's where we need to make our a concerted effort. But the sad part about it is, even when we do education efforts within the education system in the schools and whatnot, when some of these young people go home, their parents, will say, "Oh, never mind that. That's just them doing their thing," and police officers want to increase their budgets and yada yada yada. So you'll see negative reinforcement sometimes from the home setting if their parents are cannabis consumers and stuff like that. But speaking to specific education about cannabis, I kind of alluded to it earlier that the funding that Karen just mentioned was the funding that we used for the cannabis specific position that the RCMP will have shortly. As I said, the person that's been selected for that is former police officer, but a DRE instructor. So I think he's well suited to do that. And of course, it's going to be a broad ranging audience. So he's not going to be earmarked specifically for the schools, but he'll be going in to businesses, into some of the major stakeholders in that to lecture as well. So he won't be just for the school age children, but for broader audiences as well.
I'd like to just add on to that. I'm just really excited to hear that there's some dedicated resources to public education. And I loved hearing that, we do need to focus on the school systems because we fully agree. I think we as our CHIRP research team have been really passionate about trying to find ways to educate the public, but especially youth. And we're trying to come up with now a strategy that, gets this type of education not only into the school system, but also where youth are accessing it, whether it's through social media, peer groups, people they respect and look up to. And luckily, we've been able to form partnerships with the school board, the Department of Education, and other key stakeholders in the community to help try to pull this together, because I don't think there's an obvious way to change behaviors. And I think, as is alluded to, it's going to take a long time. It's going to take, slow, persistent effort to get this information to the hands of youth and hopefully eventually change those behaviors. Hopefully it won't take quite as long as it did with alcohol, but it's definitely going to be an uphill battle for sure. But we want this to be informed by the youth, by educators, by parents, so that youth are getting a consistent message, across the board, and not those conflicting messages like was alluded to. So I'm excited to hear you guys say those things, and I'm hoping we'll be able to get some of this education out there soon too.
Great. So the next question for Dr. Weber. So does a testing or saliva testing show the level of improvement? Prisiliers, so can show the level of improvement, while the saliva test only gives the evidence of the substance, not the impairment.
Yeah, so the saliva test, I mean, that's a biological fluid. So it's, you're measuring in there, and Sgt Didham talked about this, and you're hopefully, you're catching the active THC. So that would suggest that you could more accurately suggest that's contributing to impairment, but that on its own doesn't show you're impaired. You have to do behavioral tests to show if somebody's impaired or not. And so therefore you would need, and we're talking about driving here, this can be operating heavy machinery at work as well, is that if there's a perceived impairment with driving, there'd be suspicion that that person is impaired by, alcohol, other drugs, in this case, cannabis. And then of course you do the roadside screening test, as Sgt Didham talked about. But on its own, no, that saliva test is backing up the fact that person may be impaired by THC, the active component, major active component in cannabis. So that alone, just that measurement, is not suggesting someone is impaired. Impaired is our behavioral deficits. So you need, same thing with alcohol. If someone takes a breath test with alcohol, and they're at 80 mg% or 0.08, that is the intoxicated level. They may not show obvious forms of impairment, but you kind of need a blanket level for society, because otherwise, where do you make the cutoff? You can't make the cutoff different from every individual. And that's what we're striving to do with cannabis as well. And I think, you heard this as well. I think if you smoke a joint and you don't know what your nanogram milliliter percent that's going to produce in your urine or blood, then just don't drive. Just don't get behind a wheel. You don't know how impaired you are. You don't know what level you're going to be at, then just don't take that chance. I think that's just the safest decision to make. So that's, I think, my last comment on that.
Great, and this is a great advice for everyone to follow and to end our webinar with. So before we close, any additional comments or idea from the speakers?
The only thing that I can add is that both the RNC and the RCMP are as proactive as we certainly can be when it comes to detection of impairment. Our education pieces are aligned together. We have an impaired driving coordinator. We have a coordinator specific for drug impaired driving. So if anybody has questions or concerns, by all means, reach out to myself. You can reach me just through 729-8000 at the RNC's number. And I'll be more than happy to share information. We have members, I know the retired member that Staff Sergeant Callahan is talking about, and he's going to do a great job. And we have great officers that are willing to do the work. We just need to know that where we need to go and do it.
Great. So I would like to sincerely thank all of you, like John Whipper, Karen Didham, Stephen Carnahan, Jennifer Donnan and Dalainey Drakes, for their time for sharing your experience with us. I'm sure we have learned a lot today, and thank you all for out there for attending and for your great questions. If you enjoyed today's session, please check out our website or social media accounts for more upcoming events. And there is one more session in this series, which will be held 2 weeks from today on the information of medical cannabis for healthcare professionals. We also have some general information and resources available on our website. So finally, we would love to hear what you think about our session today. So your ideas for future sessions. You will be receiving an email with a link for a feedback form, and we will post this link on the chat. So if you'd like to complete it now right away. Thank you all for watching today, and we hope to see you in our next session. Thank you.
Thank you for the opportunity. Thanks.
Yes, thank you.
Thank you, Dina.
Yes, thank you, Dina.